From A-list celebs to ordinary folks, the buccal fat trend has everyone asking one question. What price would you pay to make yourself look beautiful? The stigma surrounding plastic surgery seems to have dissipated in recent years. Psychology Today suggests that the influence of social media has played a key role in this pivot, not only by driving more people towards plastic surgery, but also by balancing feelings of fear and shame with education and exposure. Deciding what you want to nip and tuck often comes down to following what's on trend, and one procedure that may be flooding your feed right now is buccal fat removal, the surgical removal of the pad of fat between the cheekbone and the jawbone. In an exclusive interview with Health Digest, Dr. Michael Horn, a board-certified plastic surgeon, reveals the truth about the procedure that has taken social media by storm. If you too have drooled over Edward Scissorhands' dreamy cheekbones, you likely understand the allure of highlighting one's bone structure.
What are you trying to get crazy with, is it?
Dr. Horn explains, the purpose of removing buccal fat is to slim the cheeks and surgically target the area of the cheek hollows. Even though a full and soft face is associated with youth, some people find that if this area is too full, it gives off a chubby appearance. Dr. Horn points out that everyone has buccal fat pads in the hollows of their cheeks, but they're naturally bigger in some people. Really, it's just a matter of facial structure, and what you're born with is what you've got, unless you schedule an appointment with someone like Dr. Horn, that is. Understandably, people with larger buccal fat pads are most often the ones looking to have buccal fat removal. Dr. Horn says that it would be just as unlikely for someone with a gaunt face to seek out the procedure as it would be for a surgeon to agree to do it. He notes that doing so would make them look more caved in as they age.
He chose poorly.
The popularity of buccal fat removal is a fairly new phenomenon, says Dr. Horn. He explains, according to data from Google Trends, searches for buccal fat removal shot up dramatically starting around December 11, 2022. He pointed out that model and entrepreneur Chrissy Teigen had announced she had the procedure done in late 2021, and there's since been speculation that many of her celebrity peers have followed suit. Pointing out one major reason why the buccal fat removal is so coveted, Dr. Horn says, this procedure can make the cheekbones look more pronounced by removing the buccal fat beneath them to create a slimmer and sleeker-looking face. Older patients might seek the procedure because the buccal fat pad can droop and is subject to gravity, resulting in a heavier and jowly lower face. At the end of the day, though, Dr. Horn says it's all about what's in at the moment. No procedure is without its risks, of course, and Dr. Horn asserts that this goes for buccal fat removal too. Because facial volume in the treated area is removed, the procedure can actually prematurely age some patients by having a hollowing effect. Dr. Horn says, it looks flattering when performed on a younger person with abundant facial volume. As that patient ages, they could risk looking gaunt in that area. And once that buccal fat is gone, there's no getting it back. If you later decide that you want that volume back in your face, Dr. Horn says you can only achieve this with the use of cosmetic fillers. He explains, those contemplating buccal fat removal should consider the risks and understand how their results might change over time. If a patient loses a significant amount of weight post-buccal fat removal, or as they age, there is a chance that they could look more hollow than they would like. Some of the rarer side effects of the surgery include facial nerve damage, salivary gland damage, deep vein thrombosis, excess fat removal, and facial asymmetry. Dr. Horn adds, in terms of safety, a skilled plastic surgeon also knows that ducts and nerves are enmeshed with the buccal fat, so the surgeon has to be cautious not to damage them.